Hello everyone. I saw a post the other day on a social media Facebook group where a dentist was asking whether it's important to install a security camera in treatment rooms and whether it's okay or not, and what is the importance of it as well. So I want to share with you my thoughts on that topic. First, for credibility, my name is Khaled. I have been a dentist for 20 years. I run an own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. I took it from 1 chair to 10 chairs, from 3 staff members to close to 40 staff members over the course of 14 years. And you can check my details below for credibility. So number one, I do have cameras in my treatment rooms. But first, of course, it depends on your state, on your country, in your area. You have to check the regulations, the requirements for that as well, about whether you can have camera in treatment rooms or not, where it can record, where it can store the recordings and so on, and patient consent and all of that. So you need to check the legality of that in your area. But I'm giving you the benefits of having that if it's okay in your area to install. Number one, from patient perspective, most hospital theaters will have some sort of cameras as well in the theaters. Number one, if you're doing sedation or some sort of anesthetic, you don't want a patient coming back saying that something wrong happened to them, whether physically or treatment-wise or sexually, or any allegations that they can raise against you, or you push them off the chair and they fell. Sometimes some patients can hallucinate during anesthetic. You might think they fell off the chairs, they hurt themselves in a certain way, or you hurt them in a certain way. And having those footages or those cameras will always be a good protection for you to show them that nothing happened. And if it gets into a legal case, it can defend you. So from a patient perspective, also infection control, I remember one patient, for some reason, maybe they wanted some money or something, many, many years ago, they were claiming that there was blood everywhere on our light, or blood on the bench or whatever. And they were trying to threaten us, they're gonna go through like legal action against us. And I just invited them to, I was really early in my ownership, so I wouldn't do this way now, but I invited them to practice. They came, let's talk about it. And I sat them there and showed them footage of the treatment room before they walked in, how there were actually, luckily, 2 nurses wiping everything. They were wiping the light multiple times. Everything was wiped. Like, okay, you can see now how many times everything has been wiped. And you can see our cameras were really good as well. You can really zoom in and you can see there is nothing, as you mentioned there. Patient went quiet, walked out, never came back, of course, but you can use this for your own protection and for any allegations. So from a patient perspective, it's very important. Again, it's any sort of allegations that's raised against you, infection control, sexual harassment, physical injuries, anything in general in that area. Timestamp, so we have patients who say, I was seen late in the room. I came at 2 p.m. for my appointment, the dentist was running late, they saw me at 2:50, whatever. Again, we have really good timestamps on our cameras. We can show them exactly what times they walked into the practice, what times they walked into the room, what times they walked out, if needed. Staff is very important for staff training. If there is any, again, allegations from clinicians that one staff is not wiping the rooms properly or not doing certain things properly or infection control-wise, we can bring this up and really know what's happening there. We can zoom in, we can show the staff, we can train them better, we can show them how to change ways. Missing equipment, missing instruments as well, accidentally went to the bin or something like that, we can always go back and see when is the last time we used that equipment, and we can really track it really well in the practice and see where it went and where it was binned, and hopefully we can find it if we can, or at least someone can get better training on that. So from a staff perspective, training is very important. HR never happened, and hopefully it never happens again. Any sort of allegation of physical or sexual harassment as well, or any or trauma or abuse, anything like that, big allegations require big evidence. If anything raised like that, we can always extract the footage and prove that nothing of this happened. Never happened, hopefully it will never happen, but it's a good source of protection from an HR perspective as well. There is probably a lot of other benefits that I probably don't remember now, but those are the main things that I thought were relevant. And if you find this information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about our videos, please subscribe to my channel, and I will notify you when more videos are released. Thank you so much for listening to me. It means a lot to me.